Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show.
I'm Joe Halko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month in this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Dialectical Behavior Therapy. Dialectical Behavior Therapy, also known as DBT, has been one of the most researched treatments for individuals diagnosed with borderline personality disorder. DBT was invented by Dr. Marsha Linehan, a psychologist, who used her own insights from living successfully with borderline personality disorder to develop this novel therapy. To discuss dialectical behavior therapy in greater detail, I'm pleased to introduce this month's guest, Sue Shaffer, a licensed clinical mental health counselor and NCSS Outpatient Team Leader. Sue, welcome to the program.
Thanks, Joe. It's good to be here.
Well, let's get started because I have a very exciting topic this month. And let's just start with, what is dialectical behavior therapy?
So dialectical behavioral therapy is a cognitive behavioral therapy that was originally developed by Marsha Linehan, like you said, to address self-harming and suicidal behaviors. A lot of folks with those behaviors do have the diagnosis of borderline personality disorder. What we found over the years, though, is that this therapy is really supportive to anyone who struggles with emotional sensitivities and has difficulty managing their moods and emotions. And so it works transdiagnostically across diagnoses, so folks with anxiety, depression, post-traumatic stress disorder, addiction issues, all benefit from this therapy.
So what's nice about that is, as you say, it's really across a continuum of disorders, so that you can be very effective whether somebody is dealing with depression or, as you say, substance abuse, or I would even guess a combination of any of the two. Yes,
and we work at DBT, works at teaching skills to help manage emotions and behaviors.
Now, what does dialectical mean, and why is it called that?
So a dialectic is when 2 opposites or 2 opposing things can be true, and that when you can hold that both, that there's more than one perspective, a third thing can emerge that can be really helpful. So it's sort of the nature of reality is that there are good and bad things that happen, that we can feel different things at the same time, that I might see something one way and you'll see it differently. For any situation, there are a zillion ways to interpret it, and what happens is when folks get fixed on this is the only way it can be, that they then start having behaviors that are problematic. Most people, when they become suicidal, is because they can't see any way out of the pain and distress that they're experiencing. And if they could see another side, it might shift the way that they go forward with what's happening. Same thing with relationship issues. So often, when people can only see one way, it causes interpersonal problems. And I can give you some examples.
Sure.
So you might say, I love my kids and they drive me crazy, or I love my spouse and I want them away from me, or I want to be sober and I want to drink. And so if you can acknowledge that that's okay, that that's a normal part of life to have both this and that, and to work with moving forward holding both, that you can have more peace in your life. And that when we don't, that's when we end up suffering and having a hard time, and there's a lot of distress.
And what is borderline personality disorder?
People who have borderline personality disorder struggle with impulsivity and quick reactions to things, and are more emotionally sensitive. And it usually comes out of, there's what's considered biosocial theory, that some people are just born more emotionally sensitive. It might be a genetic disposition based on the parents and grandparents. Sometimes it's just that's the way you are. That's the biological piece. And then socially, if you come into the world emotionally more sensitive and then are met with an invalidating environment where you are told that your feelings don't matter, or they're not important, or they're dismissed, that causes more reactivity, and you have a harder time in life. So if you're saying I'm hungry and your parents are telling you that's silly, you just ate, or you're saying I'm cold and that's dismissed, or if you're just dealing with things in life that if you're neglected, or if the people that are supposed to love you and take care of you end up hurting you, you're given messages that you don't matter, that you're not important. We call that an invalidating environment. So folks with trauma, folks who have suffered trauma through racism and sexism and classism, anything in our society that tells you that who you are is less than, or you're treated as invisible, can contribute to these circumstances. Now I'm going a little bit off task. Not everyone who's dealing with racism and sexism and all that will be diagnosed with borderline personality disorder. I just kind of got off track. I'm just saying that can impact you to have a greater response to environmental stressors.
And the other thing too, Sue, is when you talk about trauma, and everyone has probably suffered some sort of a traumatic incident in their life, if not multiple times. And I know we as a trauma-informed organization moving towards that is very valuable, not only for staff, but for those that we serve. And I only bring that up because, as you were mentioning about trauma and its potential effects on people.
Right, and so DBT is very effective in addressing these things, and we'll talk about that in a little bit.
Okay. Now, what are the goals of DBT?
So the main goal of DBT is to get folks into their wise mind. Marsha Linehan believes that people have 3 states of mind. We have a reasonable mind, an emotion mind, and a wise mind. Emotion mind is when our emotions take over and we feel very passionate, or we get impulsive, and there's no thinking involved to help us decide if our behaviors are in alignment with our values or what's best for us. We're just acting all on emotion in the moment. Reasonable mind is when you're really devoid of any feelings and it's all logic based. It's the part of your mind when you're making a spaghetti sauce or using your GPS to get somewhere. There's no feelings involved. It's just, working out of logic. And if you just have reasonable mind or just have emotion mind, it's problematic. You need to find a balanced way of being in the world where you feel centered and where you're in control of your emotions and you're in control of your thoughts. And so DBT is really all about finding that centered place so that you can learn to tolerate what's intolerable, learn distress tolerance skills, regulate your emotions, have positive and effective interpersonal relationships, and be clear about who you are. So the wise mind moves into the 4 components of DBT, which is the distress tolerance skills, emotion regulation skills, mindfulness skills, and interpersonal effectiveness skills. And to get to Wise Mind, you are using mindful practice and awareness. And so at the core of DBT is this mindfulness practice.
Now, speaking of the core of DBT, how is the overall treatment structured?
So the overall treatment begins with a skills group that meets weekly and has 2 facilitators. And we always begin skills group with a mindfulness practice, and then we will review homework and we'll teach a skill, and then at the end of the group we'll assign the homework for the next week. And so folks will participate in skills group from 6 months to 2 years, just depending on the context. DBT happens most often in an outpatient setting. So there's the skills group. The other component is individual therapy. So you're meeting for an hour a week with your individual therapist who is DBT trained as well. And many programs offer phone coaching, and that is a part of the DBT program. And at NCSS, our crisis team is providing the phone coaching.
And is this particular DBT model useful for other populations as well?
Like I said, it was originally designed for folks with very acute behaviors. So if you know people, or if you yourself are really struggling with self-harm behaviors, suicidal behaviors, feeling like your life is not worth living, DBT is an entry point. If you're just in general having a difficult time finding that it's hard to maintain positive relationships, some of the things we were talking about before. So I think DBT is useful for everyone because it really provides skills to find your center, to be okay with whatever it is that's going on around you. There's so much in this world that is so hard to be with on so many levels, whether it's globally or in the community or in your family or just within yourself. We are constantly having to deal with things that are challenging and that cause us pain and distress. And so how do you manage that? And so these skills really help you to be able to manage that. So often our own thinking also gets in the way, and we tend to, people will sabotage their own behaviors or just feel like they're not moving in the direction they want to just because of things that they tell themselves. And DBT is a really effective therapy to working with those thoughts that get in our own way. And it goes back to the mindful awareness and the skills that we teach.
And you know, Sue, one of the things as you're saying that goes through my mind is that when you talk about how people are dealing with their environments, and when you think of today's world and with things such as the internet and information overload and a lot of information that isn't really validating, but people who are just out there trying to stir things up or what have you, but makes me think that as we go forward as a society is that there's going to be more and more of a call for DBT. Just looking at it again as a non-clinical person, only because as we begin to see and peel away the layers on things, say as technology, and people who can become upset over things that are posted on Facebook or whatever the case may be, versus years ago, the only way that they were going to be able to interact with individuals is like we are, one-on-one, or certainly talking via some kind of a mechanism like a telephone, and that was, through the mail, and that was about it. So I guess all I'm saying is that with what I hear you saying about DBT is looking at it futuristically, if you will, I see that there will be even more and more need for people to seek services. As you know, one of the biggest challenges that we as an organization face is that you have stigma And people who believe that, no, I don't need any help, maybe their pride gets in the way or whatever the case may be, but the delays in which people will take before seeking services, I know is also a concern, because you can go from very, very mild depression into a moderate stage before maybe you seek help. And then that, I would imagine, then puts the person on a longer timeline as far as being able to have them see benefit. Would that be a true statement? Or? But with what I'm hearing about DBT, though, it just sounds so encouraging that a lot of people, and even going back to where you said first it was designed because of things such as suicidal thoughts and self-harm. And as we know, not only in Vermont, but as a society, unfortunately, suicides are not going down. So more and more every day there are people that, if we can just find, when they're calling for help, how to address that in people before they take that last step, that last unfortunate step. Why is DBT considered to be so effective, say, versus some other approaches with clients?
I think it has to do with what we know about the brain. We are hardwired as a species to go, our nervous systems, to assess for safety and go into a fight, flight, or freeze response in relation to what's going on in our world. And the mindfulness practice and the skills taught in DBT help us to regulate our nervous system in an effective way. So the skills provide a concrete way to actually find your center, as opposed to going into an automatic response. And it's that automatic response that we get locked into that causes us problems. And I think folks who have borderline personality disorder tend to, based on the emotional sensitivity and the invalidating environment, tend to go into a state of hypo and hyperarousal at the same time. It's sort of like the fight and flight are activated in unison. It's like stepping on the gas and the brakes on the same time. And if you can imagine that, it's an out of control experience. And so these skills can actually cause you to go into equilibrium so that you are then feel like you're in control. They change your brain system so that you, with enough practice, that you can actually pause and think about, what am I about to do, as opposed to that 0 to 60 where it immediately happens, you have that immediate reaction. So practicing these skills regularly so they become second nature actually impacts your nervous system, so that when there is a trigger, you pause. You can imagine you're driving on the highway and someone cuts you off and you have an immediate reaction. Oh my God, what are they doing? And that can be problematic. It causes road rage. People get, we see in the news that people really lose their temper. But with enough practice, the same person, someone can cut you off, and rather than go to that immediate reaction, you take a breath and it's like, what just happened? Oh, and then you respond. Well, maybe they were maybe they didn't see me and something. So it allows you to see things from that wise mind perspective.
It's interesting. Now, I know you've talked about this a little bit, but can you give us an example of some of the skills you teach and sort of how you get there and then work through it with someone?
So mindful awareness is just taking some time to have a singular focus with a non-judgmental attitude, fully participating. And when you are able to do that, your mind and emotions will still, things will fall away, and it's it helps you to find that center point. So for example, you can do anything. It doesn't have to be the traditional meditative exercise. But that's usually where we start. So for example, you might want to just put your feet on the floor. We would tell folks to imagine the chair supporting you, and as you breathe in, notice the temperature of the air as you're breathing in. And then as you breathe out, notice the temperature of the air as you breathe out. And in order to do that, your attention needs to be fully on
100%.
the air as it's entering and leaving. And in that moment, your worries have to stop, and anything else that might be going on in your head, because your attention is all right there.
Mm-hmm.
Another example for people who have trouble, sometimes focusing on your breath can be activating if you have a lot of trauma or for a variety of reasons. And so one thing you might do is to just pick a color. Like if I were to say, let's pick the color blue, and let's identify things that are blue. And so I would look around, oh, your pen is blue, the cup is blue, the banner is blue. And when I'm doing that, it's hard for me to think of other things as well. It's this mindful awareness. You're focusing on one thing. You can focus on a point in the room, a candle flame, a flower. Focus on anything that comes in through your senses. Just notice what you're smelling. You play a game. Sometimes there are, children's games. Simon Says. If you're playing Simon Says, you have to be singularly focused, So there are a variety of ways, and everyone's different, so we offer a variety of ways so that people can find what works best for them.
That's what I was going to ask you as a follow-up, is because people are so different, each and every person being an individual, that certain things may work for this part of the group, but something else needs to work for that part. How does that impact, because you had said that the individual or the person goes to individual therapy and then as well as group. So I would imagine in group there, depending on how many people you have, you could have a wide range of things that work for people. How does that work in the group setting though, so that they can feel as if they're continually making advances?
Well, we encourage everyone to participate, and to participate non-judgmentally. And that's part of life, is that you have to do things that might not always work for you. And so to just be, so hopefully that with the variety of ways that we offer the mindfulness practice, certain of the activities will resonate for an individual. They don't have to love and embrace them all. They just need to try to the best of their ability. Yeah.
And how would someone access DBT treatment? If somebody's out there and they say this sounds pretty good.
So DBT clinicians are found all over the world, and if you're in Franklin County, you can access them through Northwestern Counseling and Support Services. If you're in other areas, you can Google DBT services, and there you will find DBT trained providers. And if you want to come and access them at NCSS, you just need to call the intake specialist here, and the number is 802-954, no?
524.
524.
I'll get it. 802-524-6554. We were teasing about this before we got on air about our number, because a lot of our staff certainly don't call our own number all the time, because there's so many direct lines and all that. But again, the number is 802-524-6554. Now, Sue, is there anything else that we haven't covered that you think would be of interest to those who might be thinking about getting involved, because maybe they know they've been struggling, but for whatever reason, as I said earlier, because of stigma, they just don't feel comfortable in getting started. And as we know, that the sooner someone starts to address any sorts of behaviors, hopefully the sooner they can learn ways to deal with them and perhaps overcome them.
Well, I would hope that folks at home would be interested based on what I've shared. And one thing that I did leave out was that DBT teaches radical acceptance. How can we accept what it is that's before us? We might not like what's before us, and we may need to work to change it, and that is a big part of the dialectic that we teach, that people are doing the best that they can and they can do better. So you have to accept what is and strive for more. But that if you knew that there were skills offered and support offered to be able to accept what you've been struggling with accepting. Sometimes that could just be struggling to accept addiction issues or loss or circumstances with friends and family that are not what you asked for or what you ever wanted. So much of life is out of our control. And so if you knew that you could come and get support to learn how to be okay with things exactly as they are right now, that nothing needs to change for you to be okay with how things are going now, that's the biggest piece. That's why I love this so much, because it's really about being okay with what is. And then once you're okay with what is, then from that center place you can move forward to really optimize it. So I would hope that regardless of any fears or just concerns, that people would want to reach out and learn more.
And change is always in the air. This is one of the things I know we talk about off air. Benjamin Franklin was famous for saying there's two things that are guaranteed in life: death and taxes. But one of the things that I've always found in dealing with friends and what have you, having lived many years myself, is if you can also accept that change is constant. Because when you think about it, if there was no change, we would still be way back, doing messages into rocks and that sort of thing to try to communicate with people. And then the last thing is that life isn't fair. And that if everybody feels that, we're all here and everything's going to go our way and that sort of thing. So I guess I only bring that up because with what you're saying, you're really dealing with all those situations where maybe people are saying, there's so much change in my life, I can't deal with it. Or the fact that, why me? Certain things seem to happen to people. And a lot of times people will say, well, why me as opposed to someone else? And sometimes I have a very difficult time dealing with that. So I would imagine that this would be very, very helpful for someone who's, I guess what I'm getting at is struggling in those areas.
Yeah.
And now when it comes, I know we've talked a little bit how you can access DBT services, and at NCSS, how many individuals actually utilize DBT as part of their practice?
From the client base?
From our client, yeah.
So we have an adult group and we have an adolescent group. And I think we have about 10 people enrolled in the adult group and 8 people enrolled in the adolescent group. Now, other folks are receiving DBT-informed therapy from the DBT-trained therapists, so meaning they're not coming to skills group, but they're learning the skills in individual therapy. So if people are interested, you don't have to participate in the group, that you can come and work on these skills individually with therapists. And it's important to know that, that all the therapists believe that people are doing the best that they can. And so, and we are committed to taking a non-judgmental stance, that really understanding the context for what's going on underneath the emotional and behavioral issues.
Sure, and with what you've shared with us, I begin to see now why, a person couldn't just be in group and try to, I don't believe that that's what you said, and move forward. They've got to have that individual therapy as well. Now, how long has how long have the groups been meeting?
I've only been in NCSS since 2013, and I know they have been going on for some time prior to my arrival.
And both the adolescent as well as the adult?
Correct.
And when we say adolescent, what's the youngest age that someone could be in group?
So 14 to 18 is
So that
our
would be the
standard,
adolescent.
yes.
Okay. Okay. And you're saying right now we have 8 individuals that are in group. Now, when you're in group, you had mentioned that the time frame could be anywhere from like 8 months to, I think it was 2 years.
6 months to 2 years.
6 months. When you have a group in its entirety, let's say we have 10 people today and they're starting, even though they're all starting at the same time, depending on circumstances, they may be as short as 6 months, but people from that same group could go as long as 2 years. What I'm saying is they're not being like, you take the people who are going to maybe need a longer period and you put them over here. They're all still in that same group, but they just seem to exit sooner. Would that be a fair?
We have people entering group periodically. So it's not just that one group starts all together. And with the skills, we want people to overlearn the skills so that they become second nature. And some people will choose to do several rounds of the training for that reason. Because it's designed for folks with suicidal and self-harming behaviors as well as other people, sometimes people leave and will need a higher level of care and will come back.
I see.
If they haven't gotten enough skills on board and before they can start to make different choices. And so that can happen at times.
Okay. Well, Sue, hard to believe, but our time is up this month. And I want to thank my guest, Sue Shaffer, for being on the show today and sharing her insights on the value of dialectical behavior therapy. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halko, and I'll be back next month with another episode of NCSS Here for You.
This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.